All right, so let me tell you a little bit about our agenda today. We're going to spend quite a bit of time talking about health, wellness, and safety. We want to be sure you all are prepared to have the best and safest time while you're studying abroad, interning abroad. And we also want you to know where you can go for support, who to contact. There's going to be tons of ways that you will be able to engage with us. And so we want to just equip you with all the great information so that you're ready to go. Again, there's going to be some time for question and answers and a breakout session, which will be more program specific. So you'll be able to get some nitty gritty details about the types of programs you are going to be going on. I am joined today by so many of my lovely colleagues in the Center for Global Engagement. And I'm going to turn it over to Sean Linker, who can introduce himself and then start the conversation. Sean.
Thanks, Carolyn. Can you all hear me all right? Good. Yep. All right. Let me first preface this by saying I'm at home right now and I have 3 cats and they're getting hungry for dinner. So sorry if they walk in front of my camera. I will try to keep them off camera, but we'll see. My name is Sean Linker. I am Assistant Director for Global Health and Safety in the Center for Global Engagement. So I work very closely with the Programs Abroad Office on international risk and emergency management issues. So I work, on health and safety, and here to go over some of those points today, and then to answer your questions later. We'll have some time for Q&A based on what we're talking about. So obviously, we wanted to start with the elephant in the room, which is your health abroad, which is related to COVID-19. Of course, that's what we've all been thinking about for the last 2, now entering year 3. So next slide, please. Oh, sort of that, yeah. There we go. Thanks for bearing with us as we are, navigating the world of Zoom. Appreciate it. So yeah, we wanted to make sure we're talking about COVID-19, Omicron variant, where things stand. Obviously, we haven't been running programs for the last 2 years because of COVID, and the world has been kind of shut down. And so we're really excited, as Carolyn mentioned, that we can finally start offering programs again. We think we're in a place where, with the proper mitigation strategies in place, that students can have a really great and productive time abroad. And we've already been sending students since last summer. So it's very, very possible. We've learned a lot in the last year, and we're excited to support you as you all embark on your programs this summer. So we are still seeing, it's not a surprise. We're seeing in the United States and some bigger cities too, like a spike from what they call the Omicron subvariant BA2. So obviously we all went through the big Omicron wave earlier this winter, and now we're seeing this subvariant that is even more contagious somehow. But it still seems, with the proper mitigation strategy in place, like getting vaccinated, getting boosted, practicing that social distancing, and avoiding crowds when possible, and wearing high quality, well-fitting masks are all great mitigation strategies to help keep yourself safe. And so, especially among most young people, I won't say all, because obviously people have different, pre-existing conditions and things that can exacerbate conditions. But, for the average younger person, it's relatively mild. And so, again, we do want you to take precautions. We have been working really closely with all of your different programs, and to think about what do those precautions look like. You've probably already gotten some messaging about, what things will look like on your program. And that might include things like, what are the vaccine requirements, or in this case, we've moved kind of past vaccines to booster requirements. So you want to make sure you're paying really close attention to that information as you get it. Next slide, please. Like I said, a lot of programs now are requiring boosters. So if you're not sure what your program is requiring, and it's coming, summer is right around the corner, I would recommend right after this meeting, or even during it, take a look at what those requirements are, because you're going to be held to those program requirements regarding boosters or vaccines. So I think all program providers we work with now have all moved to requiring vaccines of some sort, if not boosters. And so please make sure you're paying attention to that, because depending on when your program starts, there's still time to get that double dose of a vaccine or a booster. So pay attention to it. vaccines and boosters are available on campus basically every single day, at least during the week, at the Student Health Center. So take a look at their website. You can see which days they offer Moderna on certain days and Johnson & Johnson on certain days. Again, make sure you're paying attention to what's the requirement for your program. They're also offering boosters, and PAO is sponsoring an event on Wednesday, May 11th, 12 to 1, where you can get vaccines and boosters, again, all for free. And that will be in the PAO resource room, which if you're not familiar with it, that is at the Center for Global Engagement, which is right next to the library on the bottom floor. So you can just walk in at those times. You can sign up for, we'll make sure you get the information about signing up for a slot, but you can also just walk in on those days and get a booster or a vaccine as needed as well. So just be aware that there's that opportunity coming up. I think, obviously I'm going to actually read through all of this because we want to make sure it's really crystal clear based on our experience over the last year. We've had students that basically they're about to go on their program. They didn't realize they needed to be vaccinated. And they weren't able to participate because the program provider was requiring it. And then they're still held to those, to the various documents you signed. So I'm just going to read through this real quick just to make sure it's crystal clear to everyone. But with regulations changing day to day, we strongly encourage you to check with your selected program provider, host country, and airline to determine whether this opportunity is right for you. You are required to comply with all entry and exit requirements, including full vaccination or booster status, if applicable, and any restrictions that may be in place at the time of travel. If eligibility requirements are not met, you are held financially responsible for associated costs as outlined in the withdrawal policy found in your Goals Abroad application, which is your online application system that you use for applying to these programs. So it's not to scare you or anything. It's just to say, like, it's out of our hands. These are, while the UT doesn't have a vaccine requirement, I think all the program providers now do have a vaccine requirement. They might have exemption processes, but a lot of them do not. And so just make sure you're paying attention to that. Just some general reminders about COVID is just staying flexible. I think, we've all been living with this for, like I said, entering year 3. And so we're all kind of used to, what are the proper precautions to take in this scenario, but just staying flexible because the rules can change, entry requirements can change, program status can change. I really doubt at this point they will, but we look at, how quickly that Omicron variant popped up and took over the world. It's very hard to predict. If I could predict COVID, I would be probably a very rich man right now, but I'm not rich, so I obviously can't predict COVID. So yeah, it's going to remains a challenging environment, especially when we're talking about entry restrictions and traveling across different countries. But like I said, with those proper mitigation strategies in place, we feel confident that you can participate in these programs. So it's definitely something you want to pay attention to. Again, look at your host country, look at your program providers' requirements, and make sure you're following those. I'll put a link into the chat after I'm done talking that will give you it's a great resource. It's the U.S. Department of State has a list of all the U.S. embassies abroad, and it will link directly to their COVID-19 information pages. And I use that daily in my work in terms of figuring out like entry restrictions or what's going on in host countries in terms of like masking requirements and whatnot. So you're going to be held to those standards while you're on your program. So make sure you are paying attention to them. Just being generally mindful of those around you. I'm not going to dwell on that too much because, again, we've been living with this for 3 years, but, covering sneezes and coughs, respecting personal space. If you're abroad and like you're going to a museum and they require masking, you're going to be expected to wear that mask that whole time. Following those host country rules and guidelines is going to be part of your expectations. And so that is all outlined in this COVID-19 acknowledgement for education abroad students, which is in your Vols Abroad portal. If you haven't read that yet, take a look at it. I believe it's already been available that you can sign it. It's basically saying that you understand that you'll be held to these expectations while you're abroad concerning COVID-19. And so take a look at it, read through it. If you have questions, that's when you can reach out to PAO and ask those questions. Next slide. Just generally travel tips. Obviously, what we're trying to do is we want to make sure you're having a safe and productive time abroad. Our goal is to make sure that you can focus on what you're trying to do, which is have a great academic and cultural experience in your host country or countries, wherever you might be going. So obviously we want to look out for you, but we also want to look out for others who are guests in these host countries. And what we're trying not to do is bring COVID into these countries. Everyone's dealing with COVID still. And so if you're feeling sick, or you suspect you might have COVID, do not travel. I mean, basically, we can work with you, make sure you're getting tested if needed, but I would not travel if you're sick. And then just basic advice for you would be, think about when you're leaving for your program. Some of your countries might require that you have to do a negative COVID test. So again, you got to make sure you understand what those expectations are and you follow it. You got to make sure you understand what type of test is required. Some airports will allow you to test in the airport, but not all airports do that. So again, you can't rely on that, but it might be possible. But anyway, basically 2 weeks before you travel, I would take enhanced precautions because you don't want to end up getting sick right before you go and missing your whole program and your opportunity to go abroad. So even though, I'm on campus and it sometimes feel like the pandemic is over because no one's wearing masks anymore, which, yeah, we have to get there eventually, but you want to protect your investment, both your time and your energy that you put into this, and also your financial investment that you put into this. And so I would take enhanced precautions those 2 weeks before you travel, where it might mean, limiting those, going into big popular places where you're not, big public spaces, or wearing a mask, even though maybe other people aren't wearing masks, because unfortunately, again, we've had students that have tested, they have to do that entry requirement testing. They test positive. And depending on the length of your program, that might mean your program's over for you if you test positive before you travel. So we're trying to avoid that. So I would take those enhanced precautions before you, those 2 weeks before you travel. Make sure you are packing. You'll get more information from your specific program, but basically you want to make sure you're bringing like your face mask, hand sanitizer, disinfectant wipes, thermometer. Vaccination card is going to be key. That's you're going to treat that like your passport these days when you're traveling abroad. So make sure you have that. And again, if you have questions about what you need to enter a country, like vaccination card, or if you need an official, letter from a doctor, now's the time to look at it, because you might need some time to gather those materials. So take a look at that. And then I would just, like I said, we'll give you some resources, but check these resources in the weeks and days before you travel. Obviously, we're monitoring that situation very closely too, and so is your program provider. So, any big changes, we'll make sure we are communicating those to you. But I would just, in your own interest, look at those websites and just start getting a sense of what you can expect when you arrive. Because, like I said, East Tennessee, the United States in general, it's going to be, we've dropped a lot of the precautions that a lot of the world still holds on to, especially in terms of like masking or social distancing. And so you have to be prepared. We're going to take maybe a step, not necessarily back, but we're going to be taking a step towards maybe more restrictions. And so in a way, it might feel like taking a step back, and just being prepared for that mentally, that you might have to wear a mask in a lot of settings, for example. But that's really going to depend on your particular country and what's going on there right now. Next slide. What we ask you guys to do basically every morning, I would hope you're doing this now too, is just checking in with yourself. Like, how do you feel? I'm not going to go through every single one of these symptoms, but generally speaking, these are the symptoms that are associated with COVID. But again, the new variants have changed some of that sometimes. So pay attention to what's going on in the COVID world still. But just check in with yourself, and if you have these symptoms, it doesn't necessarily mean you have COVID. But if you start having 1, 2, 3, that might be an indication that you want to get tested. And so something we can help you do while you're abroad is get tested. And in a lot of locations around the world, it's a lot easier to get tested than even in the United States. So it's no problem if we need to test you while you're abroad. Basically, you're all going to have to get tested anyway to re-enter the United States. That's been planned with your program providers. Basically, that last day before you travel, that 24 hours, you'll need that negative COVID test. And so it's been built into your itinerary that you'll go as a group and get this negative test. So that's just a long way of saying that if you need to get tested, if you feel like you have symptoms, if you have a fever, just reach out to your program contacts and we can help you navigate that situation. We can make sure you're getting that testing if needed while you're abroad. So it's no problem at all. Yep. Nope. There you go. Thanks. So obviously if you do test, if you're feeling sick or you test positive, you're going to want to make sure, if you were doing that on your own, you went and got tested by yourself, you didn't reach out to your program leaders, making sure the program contacts know, because obviously you're going to have to do an isolation quarantine period. Every country is going to be a little bit different about what they're requiring these days, but I think most are requiring it versus the United States that are suggesting it. They'll be asking you to self-isolate for a period of time. These days, it's usually about 7 days, I would say, where before it was maybe 14 days. So notify your program contacts. I would let your at-home support network know about that situation too, just again, because they're obviously worried about you. I think a lot of parents I've talked to and guardians I've talked to are still just wary about world travel, especially related to COVID. I think for those of you traveling to Europe, we've been getting a lot of inquiries about the situation with Russia and Ukraine. We're monitoring that situation very closely as well. But they all care about you, and so they want to know what's going on with you. And obviously, if you're feeling sick abroad, they want to make sure that you're getting the best support and care that you need and deserve. And so that's what we're here for, is to make sure you're getting that support and care. You'll be asked to follow the guidance from your assisting health professionals. Generally speaking, like I said, it'll be like self-isolating. So we'll be working with you to arrange housing where you'll be, self-isolating, and you'll basically be asked to stay in that location, and complying with all the government quarantine rules and contact tracing efforts as needed. So again, some countries have dropped their contact tracing because Omicron was just spreading so rapidly. Some countries still have embraced contact tracing, so it's going to be dependent on where you're going. And obviously, if you're in a self-isolation period or quarantine period, we'll give you more guidance in that scenario. But just generally speaking, like, it can be isolating. It's in the name, self-isolation. And so you want to make sure you're maintaining that healthy routine. If you have needs, we'll be working with program provider, make sure you get food and all that type of thing. But if you have needs, making sure you're reaching out and communicating those needs to us. COVID-19 resources. So just generally speaking, for travel, international travel, the CDC has a lot of great country-specific information. Same with the U.S. Department of State. Like I said, I'll put that resource into the chat after I'm done talking, just so you can access it. That's one of the go-tos I use all the time in my work. WHO, that's mostly going to be really helpful. It does have country-specific information, but that's also really helpful for if there's a new variant on the horizon or something like that, just to gain more information about what's happening in the world of COVID. Here's where I'll plug International SOS, which is our security and medical assistance provider, which is just really, we work really closely with them. They have a lot of great information. We have a next slide about that. So I'll cover that there. But then also, just if you have questions, if you're not sure how to, again, navigate a COVID protocol abroad, or you're not sure what the expectation is, ask questions. Ask questions of your program provider, ask questions of your faculty leader, ask questions of your host institution. We cover all of these because you're all going on very different programs. Some of you are being led by a faculty leader. Some of you might be direct enrolling with a partner. But ask those questions. Everyone should have an in-country orientation session where it should be establishing those COVID expectations. And that's a great opportunity to ask questions. But throughout your program, if you're just not sure how to navigate a situation, just reach out, because that's what we're here for as well. Next slide. Just things to do before you go abroad. So this is pivoting a little bit to just health in general. Obviously, COVID is a big part of your health, but it's not the be all end all. And so, especially if you have an underlying medical condition, I would really recommend you meet with your general practitioner, just to mention that you're going abroad, thinking through with them how you'll handle that medical condition. And, basically just having that conversation with them is just a good practice. Making sure, if you know yourself best, if you have medications that you need to bring abroad, make sure you have a plan in terms of refilling those before you go. If you're not sure about the legality of a certain type of medication, that's where International SOS can help you navigate that. And you can basically call them before you travel, say, hey, I'm going to Spain and I want to know if this medication is legal to bring. You can talk to their medical team, again, for free. UT is paying for this on behalf of our travelers. And so you can reach out and ask those type of questions, and that's what they're there for. And then just best practice, taking that medication with you on your carry-on luggage, not checked luggage, because you don't want to lose that. That said, if If for some reason you need help refilling a prescription abroad, or if you did lose or forget your medication, reach out to us because we can help you, again, obtain a refill or find a pharmacy, and navigate that situation if needed. And then International SOS. So like I said, they're our partner for medical and security assistance issues. So they have great before you travel resources. You can go to the website right now. We can put that in the chat as well. But basically, you can go and click on your country. You can read about the medical conditions there. You can find local clinics, local hospitals. You can read about even etiquette, and you can read about like what kind of safety risks there might be in that country, like street crime or areas to avoid. So it's just a really great resource to look at before you travel. And when you're on that website, you can sign up for email alerts through International SOS, which is really helpful. Basically, they have teams all around the world that are monitoring the situation in each country. And so say you're going again to Spain, they'll send out alerts from everything from, there's a fire and, or a security situation in this part of the city that you want to avoid, versus like protests. There's a protest tomorrow, so make sure you're aware of that and avoid that area. Next slide, I think, which is more about International SOS. So yeah, this is International SOS. This is the wheel. I don't know what to call it, wheel of well-being. But it's basically just a good example of everything that International SOS can help with. And so everything from safety and security to personal well-being to health and medical. These are all lots of great information before you travel, but they're also going to be a key resource that you can reach out to if you need assistance while you're abroad. We'll go into more detail about emergency situations, and we'll talk about International SOS in that situation too. But basically, they're a great resource before you travel and while you're abroad if needed. We'll make sure you get this information, and I'll also plug here that you can download. Their International SOS has an app, basically, so you can download it through Apple, Google, or Microsoft. And basically, you put in that membership ID number. Again, we'll make sure you get this. You'll get it in your email. But you can put that in. Again, it's free, and it's a great service because like the email alerts will push out alerts if needed while you're abroad. You can also use that while you're abroad to request assistance, for example. So it's a good resource. I would recommend you download it before you travel. Just things to do before you go abroad. Like in addition to obviously, like, again, checking with your general practitioner and arranging prescriptions if needed, but utilizing the Department of State and CDC resources, looking at that country specific information, looking at the entry restrictions, again, entry guidelines, and making sure you can meet those. Getting those required vaccinations. Again, if you're not sure about your vaccination status, or if you're not sure if your program's requiring vaccines or boosters, reach out now, because again, time is ticking, and we want to make sure that you can meet those eligibility requirements for your particular program. You want to make sure you're traveling with those documentations of your vaccines too. So most countries these days are taking the United States CDC card, even though it looks kind of fake to me. They do take it. But there are ways. So say, for example, you needed to get an official documentation. Each state has a way that you can request that. So if that's something you need, again, reach out and we can help you navigate that and figure out how you would ask that from whatever state you got vaccinated in. There's ways to get a kind of like a digital, I wouldn't call it a passport, but digital certification that you've gotten these vaccines. So if that's something you need, reach out. And then self-disclosure accommodation needs. So again, direct you to your Vols Abroad portal, which is the online system you use to apply and that you've been working on in these last few months. And make sure you're filling out the accommodation request form, which basically covers physical needs, medical needs, dietary restrictions. If we're not aware of a situation or an accommodation you might need, then we can't help you with that. So just self-disclose, and that helps us help you, basically. While you're abroad, just again, maintaining your regular patterns of eating, hydrating, exercise, looking out for yourself, doing that daily check-in, not only for COVID, but just how are you feeling? What do you need? A lot of these programs are intensive. You're there for a few weeks. And so every day is packed. And so, using that time when you're not, in classes or doing a site visit, to check in with yourself. What do I need? Do I need to eat something? Do I need to drink some water? Or do I need to take a nap? Whatever it might be. So just check in with yourself. You know yourself best. If for some reason you're traveling somewhere where you need to determine food or water safety, that's again a resource. International SOS can help you navigate that and figure out the situation. If you need to see a doctor or otherwise need help, make sure you're reaching out. We'll go into emergency protocols a little bit later, but yeah, you can reach out basically if you need anything. And then just caring for yourself and others around you, as I would expect you to do on campus too, just, looking out for each other. You're all human. Okay, so I'm going to pivot a little bit to managing your mental health abroad, just important as your physical health, because it is. I mean, your brain is your body. So next slide. So basically, it's kind of similar to like if you have a medical condition that's not related to mental health, you want to continue your ongoing mental health treatment or routine. So say you're seeing a counselor or a therapist on campus or, telehealth, whatever it might be. In the lead up to your program, I would recommend you talk to them about, hey, I'm going to X country for these dates. I want to talk about how I'm going to handle my specific mental health issue while I'm on this program. Because I think it's just, it's always going to make you feel better when you have a plan about how you'll address whatever it is you're dealing with. Everyone has their own thing, whether that's anxiety or depression or other things. So I would recommend if you have that person, talk to them and think through how you would handle a situation abroad. I know not everybody has a therapist or a counselor. So if you deal with something like, say, anxiety or panic attacks or something like that, again, think through it now. Say, what would I do in that situation if I'm experiencing heightened anxiety or if I start feeling like I'm going to have a panic attack? Just know that in all those scenarios, you can reach out to us because we can help connect you to medical resources abroad, including mental health resources. And International SOS actually has, we pay for, on behalf of all of you, any traveler, you're eligible to get 5 free telehealth counseling sessions for mental health concerns. So again, if you feel like you're starting to spiral, what we want to prevent is like something like spiraling into panic attacks, and we can help you navigate that situation. So reach out to us and we can help connect you to resources. And then, yeah, basically that's just a long way of saying disclose and self-advocate. So, you don't have to suffer alone. Reach out, we can help you. Cultural adjustment. Oh wait, I have a note I have to plug something real quick. So we'll give you this information that you can follow our social media information, but we basically have a few mental health related workshops coming up in the next few weeks. And we'll put more information about that on social media. So follow that. But basically in the next few weeks, we have a breathing exercise to calm anxiety wherever you are with Dr. Emily Pace, who's a UTK French instructor and yoga instructor. So she knows what she's talking about, and she'll be offering a session that you can sign up for free. And then we'll also have another session about Bowls Abroad alumni speaking about how to cope with homesickness. And that'll be offered by peer advisors, students that have actually already gone abroad, have been through this experience. That's Kiara Finch and Peyton Krumholtz. Almost forgot to plug those. Tips for a successful cultural adjustment. Researching your host country and cultural norms. Obviously, I've been talking to you guys about researching your country in terms of like health and safety risks and entry requirements and COVID guidelines and things like that. But I think it's in general, you want to just start thinking about, okay, where am I going? What's the actual, what am I entering in terms of cultural expectations? And so International SOS has some of that information, but there's also just like, maybe you want to read a book by somebody from that country, or, watch some movies from that country in terms of just trying to start seeing what you might be entering into. Keeping your healthy routines abroad. I've already talked about that a lot, but I think it's key, and advocating for your needs if you need something. Our goal, again, is to prevent a small thing from growing into a large, difficult to handle issue. We want to handle things when they're small and manageable. Learning common phrases in your host language, like help or where's the bathroom. It doesn't have to be, directly related to health and safety, but some of my best experience abroad when I've lived abroad have been trying out some host country language or phrases. And even though I might not get it perfectly, people have always appreciated me trying, and it has led to some great conversations I've had with local people. So this is a great way of showing that you're putting in effort. Um, being open-minded to cultural differences. If you have questions about what is the etiquette in this scenario, all of you are going on different types of programs, and maybe meeting with different types of people. And so that's, again, where you can talk to your faculty leaders, you can talk to your program provider and say, how do I handle this situation in this specific context or this specific country? And they can help you navigate that. Setting goals for yourself in general in life is probably good to set goals for yourself, but it's no less true on this program. Think about it now, like, what are you trying to get out of this, both from an academic, from an academic standpoint, from a cultural standpoint, what do you want to accomplish on your program? It's good to set those goals. And then, like I said, if you are struggling, reach out. Next slide. Here I'll talk a little bit about medical insurance. So we'll be sending this out to you a few weeks before you travel. But basically all of you, as part of your program fee that you're paying for, are enrolled in our really excellent international medical coverage that's sponsored through Chubb. And so we'll send you the policy information that you will all get this via email. On the first page of that will also have that information about International SOS, including the membership number and how you can sign up for the app. But take a look at it once you receive this. You want to read through it, make sure you understand it, make sure you understand what it's covering and what it's not covering, and reach out if you have questions before you travel, because we can help you figure out, what does this language mean? What does it cover? And here I'll mention too, that one of the things we worked on with our broker in the last year, obviously when we're trying to travel with COVID, is if you test positive or you get sick and you have to quarantine, that can have, associated expenses, missed flights or hotel rooms, whatever it might be. And so as part of our insurance, now we have $2,000 quarantine benefit. And so if you need to, again, if you're testing positive or get sick while you're on the program, we'll help you navigate that, and also help you navigate what does that mean in terms of insurance, in terms of how we're paying for things and everything like that. So that's part of your insurance. Read through it before you travel and reach out with questions about it. Oh, no, maybe I already talked about this, but let's see. Yeah, US policies have limited coverage. It's really helpful for us to make sure we know what you have, because say you're incapacitated and we are, working with your faculty director to get you medical care. We don't have to guess what kind of insurance you have. You all have the same insurance. And like I said, it's really robust, really great coverage. I wish we had it here in the United States for our personal insurance, but alas, we do not. So read through it. And yeah, if you need medical care abroad, we can help you navigate how do I get through the system? You might feel intimidated because you might not necessarily speak the host language, but again, this is where we can open up a case with International SOS. They can help navigate host languages. They can basically, if you were in the hospital for an extended period of time and we had a case open with International SOS, their medical team, including doctors, would be talking with the doctors in that hospital to make sure you're getting the adequate level of care that we would be expecting for our travelers. So we can help you figure that out, and it will help you avoid major expenses. So it is going to be like most medical or most insurance policies, like you might have to pay for things out of pocket and then submit, save your receipts and submit for reimbursement. We submit a claim, but obviously we're never going to, if you need medical assistance, we're not going to ask you to pay for it first. We're going to make sure you get that medical assistance if you need it. Okay. And so, like I said, once you get this benefit information, make sure you read through it. It's a long document, but it is really important. And so read through it. And again, ask questions if you're not sure what's covered, what's not covered. What does a quarantine benefit mean, for example? And then I would recommend you take a copy of this with you, print it out, take it in your luggage. You might not need it, but it's good to have just in case. And then I would save a digital copy of it to, whether you're using like Google Drive or your email, wherever you store digital things in your life, I would store a copy of it there as well. Next slide. Switching gears a little bit. So when you're returning to the United States, like I said, the current expectation is that everybody, whether you're a US citizen or not, will have to do this 24-hour before you fly COVID test and present a negative COVID test. And so again, we've been working with the program providers. They all understand this requirement, and it's been built into programs that basically that last day you'll go as a group to get tested. Who knows if that will change? Lots of things have changed over the last few months. And so we're continuing to monitor that situation closely. If it does change, we'll obviously make sure you're aware of that as well. And your program providers are also going to be monitoring that very closely. And once you're back, just make sure you're monitoring yourself again, sort of like what you're doing when you're abroad. Like, check in with yourself. If you have symptoms, again, go get tested, stay away from vulnerable people, isolate. Yeah. Okay, so I'm going to shift gears a little bit to safety abroad. And again, we will have time for questions. So I want to make sure you will have time for those questions related to COVID. But yeah, generally speaking, it runs the gamut from terrorism, political civil unrest, natural disasters, street crime. So terrorism, something that's like very unlikely to happen, but if it happens, it can have a high impact, versus street crime might have a low impact, but much more likely to happen. So I've been in the field for 10 years. I've dealt with lots of different, situations abroad. And by far, yes, I have dealt with terrorism incidents, but most of the things we see are at the lower end of the spectrum, like street crime. And so that's where we'll focus a lot of our attention today, like, protecting your belongings, protecting your passport, protecting your wallet, protecting your luggage, especially when you're in busy public areas or on public transportation. Those are areas where we see a lot of this crime occur. Again, we're talking about it because it happens every time we've had students abroad. We have students that get their passport or phone or wallet stolen. So just making sure you're keeping that stuff close to you. For example, when I'm on a train or a bus, I'll take my backpack and maybe just keep it on my lap, and then someone's not gonna get their hands in there. Unfortunately, the other big thing we see is incidents related to alcohol, overconsumption of alcohol. I get it, because you might not be of legal age here in the United States, but you're usually going to be of legal age in your host country, and so you have this ready access to alcohol, and it's you feel like it's going to make your experience better. But again, you're going to be held to behavioral expectations and standards as you would be held on campus, and so make sure you are being very thoughtful about imbibing. Because unfortunately, what we have seen is, students that have gone overboard, they get, hurt, injured, getting accidents, or have broken the law. And there's very little we can do. There's very little the U.S. Department of State can do if you are arrested abroad. You're going to be kind of in that legal system. And then the other thing we've seen a lot of is this interpersonal conflicts with, whether that's a roommate, housemate, classmate. That's a good example of an area where if you are having some issues with a classmate or a roommate, bring it to the attention of your program provider or faculty leader early, because again, we wanted to prevent it from turning into like a crisis situation where, bad things are happening. So we can help you navigate those types of situations as well. Next slide. Be informed, Department of State, International SOS. I think I've already plugged them a lot, so we can go to the next slide. General safety guidelines, being aware of your surroundings and no-go zones in your location. So again, International SOS can help with that, but also I would recommend, your program provider or faculty leader. That's a good thing to ask about in your in-country orientation session. There might be parts of the city or area you're traveling in that it's fine to go in during the day, but it's good to avoid during the night. And so those are great questions to ask, like more local people, like program providers that are operating in those cities. They know the cities the best. And so you can ask those type of questions to them. If you're going out, all of you will have downtime or free time on your programs. And that's an opportunity to explore the city in a different way. But I would really, really, really recommend you use the buddy system, similar to you would probably do on campus as well. If you are using the buddy system, please do not leave your buddy behind. Unfortunately, I've had to deal with that too, and that's never fun. And so, look out for each other again and use that buddy system. Again, avoid overconsumption of alcohol. 9 out of 10, I would say, incidents we deal with are stemming from overconsumption of alcohol. So, obviously it happens on campus too, where your inhibitions are down, or, you're not going to be as vigilant. And so things happen, and that's what we want to avoid. So avoid overconsumption of alcohol. Do not use illegal substances and drugs and things like that. Again, I think we've all seen Locked Up Abroad. And like I said, it's very difficult sometimes it would be very difficult for us to help you in a legal situation. You're kind of going to be held to that country's legal system, and we can't hire you a lawyer or something. Being alert when you're in public transportation. Again, this is an area where we see a lot of like the crime or opportunistic crime. Same at like public places like cafes. If you're going to the bathroom, don't leave your laptop or your phone on the table, for example. That's just asking to be stolen. Being conscious of culturally appropriate and inappropriate behavior. Again, this is something that you can ask your faculty leaders or your program contacts. What does this mean? Is this being inappropriate? What is appropriate? And just using your common sense as you would in Knoxville, when you're going out, especially at night, using that like heightened situational awareness, paying attention to what's going on around you. Don't be stuck in your phone and not paying attention to what's in front of you, what's on the side of you, and keep your cell phone charged too. Next slide. So just to kind of recap, basically, it's going to be like prepare, act, respond. So prepare. I've talked a lot about preparing, which again, where we plug like International SOS. Next slide. There it is. Know what your local and US contact numbers are. So as part of your programs, every program will be doing like an in-country orientation session, whether that's with the faculty leaders or with your program providers. Again, that's an area where you can ask questions about, health or safety, or about your host country, host culture, host city, whatever it might be. But also they'll be giving you a lot of like important phone numbers. So for instance, they'll give you a number saying, if you need assistance 24/7, reach out to this number. So when they give you that number, put it in your phone. Don't just save it and throw it in your bag or something like that. Put it in your phone, because if you need it, then you'll have it right at hand. We can also put a resource in the chat here about the local 911 equivalent. So, every country is going to have their own 911 system. Some countries it is 911. Other countries it might be like 999 or some other number. And so we'll put a resource in here that can help you figure out what that is. Because obviously, similar to as it would be on campus, if you need emergency assistance, whether that's fire or ambulance or police, we're going to tell you to call that number, basically. If you need an ambulance, call that 999 or 911, whatever it might be, and save that, or know what it is and be able to call it if needed. We'll also give you some more numbers today. You don't have to rush to write them down because we'll make sure you get it, but we have a CGE, Center for Global Engagement, 24/7 emergency phone, and International SOS, again, can be used in emergency situations and provide assistance. So you have multiple avenues here. Make hard and digital copies. So I already talked about the vaccine card. I already talked about the international insurance, but same with your passport. I doubt any of you are probably require visas because you're going for a short amount of time, but take a copy of your passport too. I would take a paper copy of it, and I would again save a digital copy. I've had students lose their passports or have them stolen, and if you have a copy, it is a lot easier to get a replacement at the U.S. Embassy or consulate. So take a copy of it or save a copy of it digitally online. And then I would recommend you share copies of all of this with your family, guardians, emergency contacts, whoever it might be that that you might turn to in an emergency situation abroad, because they also might use them. Smart Travel Enrollment Program. We can put the link is there at the bottom, but we'll put it in the chat too. Basically, it's a great service similar to what I was talking about earlier with International SOS and their email alerts. You can sign up for this STEP program, and so you basically put in your location, where you're traveling to, what your dates will be, and that kind of registers you with the local U.S. Embassy or consulate. And so they're constantly monitoring what's going on in the host country or the host city or host region, and they send out alerts as well about what's going on. So it's just a great way to stay on top of what's happening from a risk perspective. Next slide. If something does go wrong, obviously, like I said, it's very unlikely something like terrorism can happen. It's just like it would be in the United States. It does happen sometimes, but just not very likely. But if something's happening, whether that is terrorism or a natural disaster, something big happening in your host location, we're going to be checking in with you basically to make sure you're doing okay. Especially if it's like been on a weekend or a time where you have your own free time and we're not sure exactly where you are because you're not with the group, we're going to be trying to check in with you. And so Make sure you're monitoring kind of your email, especially if you know something that just happened. Obviously, we want to make sure you put yourself into, get yourself safe, get yourself somewhere where you're safe, and then, respond to our check-in or let us know that you're doing okay, because we'll be trying to check in with you. And so that might be, it starts usually with an email. If we're not hearing from you, we'll be trying to call you or text you. And in the past, I've had to use social media. Basically, we're just trying to make sure you don't need assistance if needed, if something really does go wrong in your host location. So just please do monitor that. And that's where it goes back to like keeping your cell phone charged, for example. Just quickly go over what's an emergency versus a non-emergency. Emergency is something that threatens your life, life-threatening illness, presents extreme or concerning symptoms. I would also put COVID here, even though it probably would not be an emergency for most people. Again, what we're trying to do is make sure it's not getting spread around to all of your classmates or to the host community. So let us know again if you're testing positive or if you feel sick, so we can help you get tested. Obviously, if you're attacked or assaulted, or like I said, a life-threatening accident, or local or world event deemed by your program to threaten your health or safety. So that's again like a natural disaster or terrorism. These are the things that like reach out right away. Let us know, because we can help you. And then next slide. Non-emergency, so like lost, stolen credit card, rescheduled, delayed, or missed flight, mild illness like allergies or common cold. So these are important. We want to make sure again that you are having the support you need, but you don't necessarily need to call us at 3 a.m. about it. You can still let us know about it, send an email, reach out to your faculty director, but you might not have to call our emergency number, for example, with these types of things. Next slide. Emergency protocol. So basically, like I said, first and foremost, if you need that local emergency assistance, so like if you, again, like there's a fire or you need the police or you need an ambulance, I would recommend you call 911 equivalent. Just as you would on campus, you wouldn't necessarily call the UT police, you would just call 911. And so that's what we would tell you to do in this host situation as well. And then working down, I would inform that program contact. Again, this will be something that they'll give you at your in-country orientation session. They'll set the expectation that you can reach out to this number if needed while you're on the program. And so again, program that into your phone because it's going to be a good resource if you find yourself in a situation where you need it. And then International SOS, again, they're 24/7. You can reach out to them for emergency assistance as needed. And then, like I said, we have a 24/7 phone number that's operated through the Center for Global Engagement here at UTK that you can use as well. Next slide. So these are the numbers. Again, you don't have to rush to write these all down. We'll make sure you get them, but we're basically just putting it here so you can be aware that we do have these. In particular, you'll have your program contacts, but then you'll also always have these general contacts no matter what program you're on. So that's the Center for Global Engagement emergency phone and International SOS emergency phone number. All you really have to do is call International SOS and say, I am a student at University of Tennessee, Knoxville. And that's all you really need to say. You don't even really need the membership number. But again, we put it there just in case. Next slide. I think that's it. Yeah. All right. Sorry, that was a lot of information. And thanks for bearing with me as we went through all of it. So we want to make sure you're giving you all some time for questions related to anything we just covered.
Thanks again, everyone, for sticking around. I know it's been a long orientation. If you could kindly type your questions in the chat, I will read them to Sean, or any of us in the team can answer them. So first question, how does one make a paper copy of their passport?
Well, I'm assuming that the library probably has copying machines.
Yes.
Right?
Or, hey, we could make them as well, but yeah,
I
mean, you could go ahead. Staples, or any of the stores to make a copy.
I know the library at least has some copy machines. So, but if you need help figuring out where to copy it,
scan it and print it, and then print it. Yes. Okay. Second question. Oh, never mind. These are all about. Okay. Okay, I got lost in the questions. Give me 1 second because they're all talking about the scanning and printing. Okay. Is this presentation going to be sent to our emails? Yes. Just
Yep.
as a reminder and checklist to have on file.
Yep. We'll send this out to you, and we're recording it, as we said. I think the recording might go, I'm not sure if that's going out to everyone, but you'll at least get the PowerPoint.
Okay, and I love the next question because I was wondering the same my first time abroad. Should we convert our money before going abroad?
That is a good question, and people have different thoughts on it. I could only answer how I've handled that. Basically, I always bring a little bit that I convert before I travel, just because when I get to that airport, I want to make sure I have some money if I needed to get a taxi or a bus or whatever it might be. But generally speaking, depending on your bank, when I've lived abroad, I basically was just pulling out money from an ATM using my regular debit card. And so I think it's going to be what you prefer. I would bring some money with you. You can do that at the airports, generally speaking, in terms of getting that currency. And then double check with your bank though before you travel that you can actually access your ATM. I think they're going to talk about that in the next part of the session, but basically check in to say, well, one, let them know you're traveling so they don't turn your card off, and also see if it will be an issue accessing ATMs while you're abroad.
The next question is really good too, because I was wondering this myself. What is the safest way to save a digital copy of important documents like passports, health documents, etc.?
Yeah, that's a great question. So again, it's going to depend on what you have available. I have like a password app I use to auto save my passwords, and it has a digital encryption for documents too. So that's like really protected, and I use that. If you don't have something like that, you're gonna have to check in with yourself about how, this is like a more sensitive document. And so whether that might be, again, like Google Drive or Dropbox, one of these services where basically you're going to want to check in with like what's your risk tolerance for privacy, basically, and check in and see, like, do I feel comfortable putting this on a Google Drive or whatever it might be. Make sure you're just keeping that to yourself. But that's how I would handle it.
Okay, I like the next question because I'm from Puerto Rico. What if the place we're going to does not require a passport like Puerto Rico? So I guess this is a Student Success Academy student. Do we still need to submit one on the online study abroad website? No, I could answer that already.
There you go.
Okay, let me go down. There are many questions about the currency.
While you're looking, I'm putting in the chat right now, everybody. This is that website with all of the Department of State embassies that link directly to the COVID-19 pages. So it's a really helpful website. Take a look at that. And while I have your attention too, you click this, boom. That is a direct link to log you into the International SOS website, what I've been talking about for this last hour, basically. It has it already kind of saves in the membership number, so you can access it directly. So,
okay. The next question has been brought out a lot during student advising, orientations. When will we know the other people in our program? When will we meet them? Faculty orientation, I would say.
Yes, so I think it's going to depend on the type of program. So if you are going on a faculty directed program, you're probably going to have some sort of pre-departure meeting with your faculty. It may be in person, it may be online, that you'll get a chance to connect. If you're going with an affiliate, you may not know until you get there, unless that affiliate program or partner is facilitating something ahead of time. So that is going to really play out very differently depending on what type of program you're going to go on. We will be doing some breakouts, and so some of in a little bit, and so you may be able to make some of those connections later on as well.
The next question, I'll go ahead, Sean.
Or just real quick, I want you all to have this too, because I know not everyone will feel comfortable asking questions in front of a large group. And so I just put into the chat my email address too. So if you have a question you don't feel comfortable asking now, or if it occurs to you after the session, you can email me, whether that's a health and safety question, something about your vaccines or boosters, insurance, whatever.
Mhm. Yeah, the next question is related to that, and I think you mentioned this before, Sean. Are we required to have a booster? What if we're not eligible for one before the start of our program?
Yeah, I would recommend you just reach out because we can help you figure out what are those
Mhm.
program requirements. There's so many different programs in the room right now that I can't go into what those each program's requiring. But generally speaking, most have moved to boosters or that full vaccination. It could probably be either or. So reach out. You can email me and I can make sure you're getting connected to the right person at PAO as well.
And there are many questions on the currency, so perhaps you could hold those for the breakout room, or you could email any of us. I can help you with that because I lived abroad for a while. So yeah, just email me directly here with the currency questions and I can help you with that during the breakout rooms.
I'll
Yeah,
say
that
too,
was it.
sorry, just because it came up as a question I got, you can share that email I gave you with your parents or guardians as well if they want to talk to me. I talk to parents all the time. Like I said, a lot of parents have been asking me about Ukraine and Russia, and so I'm happy to talk to them about that and how we monitor the world and how we're monitoring that situation. Sorry, go ahead.
Okay, one more question. Can we still take questions? Are we gonna, okay. Do we already have a COVID test planned to come back into the US?
Like I said, we've been working with all the program providers basically to make sure that that last day that they're thinking about, okay, the group needs to get tested. And so it should be built into your itinerary that they'll be helping you figure out where and how that test might occur.
Okay, and I think that was the last one, Sean.
Okay.
And just students answering each other. Thank you, all of you who are answering the questions.